Hello, everyone, and welcome. Good afternoon or good morning, depending on where you're calling from. We're going to get started in just a minute for our webinar today on colorectal cancer screening. Just going to give people a few more seconds to join us, and we'll begin. Okay, hello again and welcome to our webinar today, Culturally Proficient Strategies to Improve Colorectal Cancer Screening Among Hispanics. My name is Paul Baker, and I'm the Senior Director for Programs at the National Alliance for Hispanic Health, also known as the Alliance. The Alliance administers the Nuestras Voces, or Our Voices, National Hispanic Network to reduce tobacco-related and cancer health disparities. We're really glad that you are joining us today and hope that you find this information interesting and helpful for the work that you're doing. Before we begin, I wanted to quickly tell you about our network for those of you who are unfamiliar. The Nuestras Voces Network is one of 8 national organizations funded by CDC's Office on Smoking and Health and their Division of Cancer Prevention and Control to serve specific populations experiencing tobacco and cancer-related disparities. One of the functions of the network is to facilitate relevant tobacco and cancer control related webinars and other trainings to increase awareness and education on proven strategies and interventions like the ones that we'll be hearing about in our presentation today. If you haven't done so already, I really encourage you to go to our website, which is nuestrasvoces.org, and register as a member of the network so you'll be sure to receive our updates and our announcements in the future. You just click on join and fill in the registration form and then look for a follow-up email to confirm your registration. Our network partners with 11 lead agencies that serve as regional network representatives around the country and work with Hispanic serving partners, organizations, and other stakeholders located within their regions. The network's main objective is to build Hispanic community infrastructure and increase regional and national partnerships to decrease exposure to secondhand tobacco smoke, increase smoking cessation, increase cancer prevention, and improve the quality of life for those living with cancer in the Hispanic community. So we really are glad that you've joined us for this webinar on colorectal cancer screening today and Hispanics during this last week of National Colorectal Cancer Awareness Month. It's one of several activities we're conducting this month to raise awareness, connect people to services, and provide TA to healthcare providers. Efforts to increase screening for colorectal cancer really are critical as the Hispanic population in the U.S. continues to grow rapidly and get older. While cervical cancer and liver cancer both disproportionately impact Hispanics and tend to get the lion's share of attention most of the time, colorectal cancer is also of huge concern for the Hispanic community. In fact, colorectal cancer is the second most commonly diagnosed cancer in Hispanic men and the third most diagnosed in Hispanic women. And it's the third leading cause of cancer death for both Hispanic men and women. Data also show that Hispanics are among the least likely to be screened, and of course this is critical for colorectal cancer compared with other groups. Here you can see 2015 Hispanics ranked second from last for all screening methods, including FOBT, endoscopy, and combined fecal and endoscopy screenings. So we also know that lack of screening can be attributed to a wide variety of reasons, including limited access to insurance and affordable health care, lack of awareness, language barriers, certain cultural factors, use of ineffective communication methods by providers, among others. I wanted to just share a couple of resources that you may find helpful before our main presentation today. We have several consumer materials on colorectal cancer which can all be found on our website under the Resources tab for download. Basically it's 3 or 4 groups of resources. The first you see on the left there are some info cards. We have 2 colorectal cancer postcard-sized consumer handouts in both Spanish and English that encourage people to talk with their healthcare provider about colorectal cancer screening. We have a bilingual consumer brochure which covers why screening is important, how to screen, who should screen, and resources. We have bilingual radio public service announcements in case that's of use. And then finally, a bilingual 12-minute video called Que no le dé vergüenza, hable con su proveedor de salud sobre el cáncer colorectal, which translates into don't be embarrassed, talk about colorectal cancer with your healthcare provider. We produced this video some time ago now, but it's really worth taking a look at. It's engaging, informative, consumer-friendly introduction to colorectal cancer, which encourages people to talk with their providers without embarrassment. The issue of embarrassment was we found to be a major barrier to screening during community discussion groups, which informed the development of this video and other materials. This video, in fact, we were approached by New York University School of Medicine to use this video in a randomized control trial of a multi-level intervention to increase colorectal cancer screening among Hispanics, where the participants were shown the video and the brochure from the previous slide, and the results revealed a significant difference in screening. The overall rate of completed screening was 55% for the intervention and 18% for the control group. So here you just see some screenshots for the video. It was hosted by Leon Singer up in the top left of the screen, a well-known Mexican-American actor, and then real people who had colorectal cancer or polyps and who talked about their experiences. The video also features a gastroenterologist from California who reviews colorectal cancer signs and symptoms and various methods of examination. And it also covers incorporating a healthy diet and exercise as a way to help reduce colorectal cancer risk. So again, if you would like to access this video, to download it, or other resources, please feel free to do so on our website, nuestrasvoces.org, and look under resources. So at this point, it is my pleasure to welcome our guest presenter, Ricardo Lopez. Ricardo is president of Hispanic Research, Inc., and was the principal investigator for the colorectal cancer focus groups with Hispanics commissioned by the American Cancer Society's National Colorectal Cancer Roundtable last year. Mr. Lopez has studied the U.S. Hispanic market for over 25 years and specializes in healthcare studies. He understands the complexity of the U.S. Hispanic community and is often quoted as a U.S. Hispanic market expert in national business and consumer publications. Mr. Lopez received both a BS and a BA degree in marketing and mass communications from King's College and an MBA in marketing research from Syracuse University. And so before I hand it over to Ricardo, just a note to everyone, we will save time at the end of Ricardo's presentation for questions. So please note your questions in the questions box here that should be shown on your screen or in the chat section, and we'll get to those questions at the end of the presentation. So without further ado, Ricardo, thank you very much for joining us today and sharing this valuable information.
Thank you for having me. So basically what I will be doing, and hello to everyone here, I will be sharing with you the results of the research we conducted. Let me get to the beginning here. Basically what we did is we conducted focus groups in 2 stages for this project commissioned by the American Cancer Society, and we went out, we got some information about the Hispanic market, we talked to people in different markets, and we, based on the information that we collected, some messages were created and some information was put together, and we went out and we tested that information. So I'm going to take you through all of that. Basically, I'm going to start the presentation with what we learned about the Latino perceptions about health. And quickly to go through this, and some of this, is something that you may say, oh yeah, of course, but some of it was surprising to some of the people behind the research. One of the things, first of all, that Latinos do care about the health. It's not like they don't care about it. Everybody that we talk to say, yeah, we care about the health. The problem is that not everybody has the access to health information. Because we ask them questions of, okay, what do you do about it? How do you know how to stay healthy? And the information was not there. The answers, they did not know exactly where to get information, or were relying on sources of information that was misinformation to begin with. Overall, they tend not to go to the doctor unless something is wrong, and that was overwhelmingly throughout the findings. We heard that over and over again. They are busy. They're living, their life. They're working hard. They have multiple jobs, some of them. They are not, as long as they are feeling okay, they're feeling healthy, they're going about their business. They're working hard for their families. The problem is that they're not prioritizing preventive health, because they're thinking, I'm fine, I'm working for my family, I'm doing what I'm supposed to do, and they're not thinking about health until something happens. They do have a fear of medical procedures, and whenever we talked about anything medical, that came across loud and clear that, there's this fear, which becomes a barrier, of course. They have the fear of the unknown. This was huge. Latinos have this fear of death, that nobody talks about death. Nobody talks about anything that is related to death. And cancer is, in their mind, very much related to death. So they're not going to talk about cancer. Anything that is related to cancer, they rather, bury that, under the table. They're not going to talk about it. They are also very much bound by faith, which could be problematic in something like this, because they will say things like, well, I trust that, God is taking care of me, I'll be okay, I pray, that type of thing, not thinking beyond that, not thinking about anything preventive. They rely very heavily on home remedies. We heard that over and over again, and not only on home remedies, but on the opinion of other family members about what would be a good remedy for them. That goes back to the first point here about, not having always the best source of information, because, abuelita may come and say, hey, the best thing for this is aloe or is whatever, and, a tea or whatever it is. And that is what they are following, thinking that this is the best remedy because they trust their relative more than anything else. They can, however, be persuaded by friends and relatives to go to the doctor if that is the case. In fact, that is a way to get, especially the men, to follow up and go to the doctor if the children or the wife is persuading. But other than that, it could also go the other way if they get misinformation. We talked also about the perceptions not only of healthcare in general, but of specifically cancer screening. So some of the things that they said, they feel some tension in their relationship with doctors. There is this whole thing about the Latino relationship with the doctors. In the Latino community, we communicate a little bit different. We tend to communicate at a very personal, I call it a spiritual level. We are very emotional. We connect at that emotional level, and we want any relationship to be connected that way. Doctors in this country tend to be very much in the system that they have to watch their time, they have to be very quick, they don't have enough time to spend with a patient. And what happens with all of this is that they don't build that type of relationship with the doctor. They sometimes feel that the doctor is too cold, the doctor is not engaging, and if they don't have that relationship, they don't have the trust. Now, if they do have a doctor that they have that kind of trust with, it works very, very well, and they're following that. but there's always some tension in the relationship with doctors. In fact, some of them would say that the relationship with the Latino doctors, if the doctor is Hispanic, himself or herself, sometimes it's better, but the reason has nothing to do with language or anything else. Is because of the way they communicate, even, actually checking them and examining them and not looking at a computer and not just asking questions and making eye contact, all those types of things. They view cancer screening logistics as a barrier. Now, if they don't think it is that important, or they don't understand the importance of the screening, then they're going to come up with all sorts of excuses why not. And the excuses to them are valid. And some of the excuses is like, I don't have transportation. It's too far from my house. And, I work all the time. I work during the time that the doctor is open. I cannot go for the test, for the colonoscopy, because, you need all this prep work ahead of time. I work at a job that doesn't give me the time off, so I'm losing the income if I have to do this. There are all these logistics that are associated with cancer screening. Now, once they understand the importance, they'll figure that out. Those things are secondary. The problem is that they don't understand the importance, and all of a sudden, those logistics become a big barrier. They also view cancer as a strong source of fear. It goes back to what I said before. Cancer is associated with death. Death is, they are very much have this fear of death, and anything that is related to cancer, they fear a lot and they try to ignore. They have a low awareness and knowledge about colorectal cancer in general. As a matter of fact, the lack of awareness goes as far as not even knowing what the colon is. So, some of them, we were talking about colorectal cancer and the colon, and they were saying, oh, what is colorectal cancer? Is that the same as prostate cancer? It was a complete lack of awareness. There was a lot of misunderstanding. And that lack of knowledge, of course, becomes a barrier in terms of screening. They have minimal awareness and knowledge of the screening test themselves. So if they don't even know what colorectal cancer is, much less what the screening test is for colorectal cancer. Some of them will know about colonoscopy if it's mentioned, and some of them said, okay, colonoscopy, but they don't even know exactly what colonoscopy is unless they have somebody close by that have gone through that. But to be honest, a lot of them said that, oh yeah, my father did it or whatever, but they don't talk about it because it's one of those things. You don't talk about medical procedures. You don't talk about all of this. So it's not a conversation that even if a close relative went through it, they didn't know. They didn't have that information. So the top barriers overall, the lack of information that I mentioned regarding healthcare, colorectal cancer, the screening, the fear that we mentioned as well. So the fear of the unknown, they're holding them back. Affordability, definitely an issue because, if they don't have the money, it costs money. If they don't have insurance to pay for it. So that becomes something that, to them is important. However, I must point out that when we talked about once they understood the need and the importance, they figure out the affordability. So that became secondary many times. Machismo is huge, especially with men. You would think like, okay, this is something that we talk about, but we understand that we go beyond that. Not the case. And when it comes to colorectal cancer, anything that is the colon, if men will say things like, oh, there's no way I'm going to have anybody check me that way. That's not going to happen. That's simply not going to happen. Some of them go as far as saying, I'd rather die than go through a colonoscopy or something like that. Now, we will find out, a little bit later, is that this changes very rapidly when you change it from, hey, it's not you, it's your family, and you look at it from a different angle. All of a sudden, they react differently, and the machismo can be tackled that way. No knowledge that colorectal cancer screening can prevent colorectal cancer. So they have absolutely no idea that this is the case, that there's, that the screening test, in particular, the colonoscopy, can actually prevent colorectal cancer. To the extent that when we tested messages that said prevent, I remember very clearly one participant in a group in Los Angeles stood up and pointed out to me, excuse me, let me correct you. It's not prevention, it's detection. Because he was so convinced that there was no way to prevent colorectal cancer. And when we went through all the messages, and at the very end of the group, I remember he came back and apologized and said, I was wrong about that. But there is this idea that, there's no way to prevent. And the doctors are not explaining the need for screening effectively if it comes up at all. So we heard that over and over again, that the doctors do not explain the need. Now, to the defense of the doctors, we also know that a lot of them that are not going to the doctors, when they go to the doctor is for, sometimes they have issues that are very big issues dealing with diabetes or something else going on in their lives. And, the doctor is going to pick their battles. So it's not going to push, colorectal cancer screening at that point. But definitely it's those that were going to the doctor for general checkups who said that the doctor was not really explaining the need. So in terms of the perceptions of the screening option rather, we explained different tests that can be done for colorectal cancer. And they, as I said, they were not aware of pretty much any of them, except a few of them had heard of colonoscopy. The one that was seen as easy and effective, and they thought it was great, was the fecal test, because the colonoscopy brings with it that fear. There's that fear. The machismo is involved with it. There's a lot of things about the colonoscopy that, it disrupts their life because of the prep and all of that. But all of a sudden was something that they said, oh, that's easy, that's affordable, it's not scary, it's convenient, it's effective. So it was something that they can definitely get. Now, the colonoscopy, however, was the one that was seen as the most comprehensive, because it removes the polyps, it examines the colon. Once we talked about it and we studied it, they were clear that this was something that could actually prevent, and they understood that. So what are the recommendations in terms of reaching this audience? One of the things that worked very well, and it's a recommendation that came out of this research, is using statistics. Just when we said something like, colon cancer is the second leading cancer killer among Hispanics or Latinos in the U.S., that was an eye-opener, because they didn't even know what colon cancer was, or they had not heard. They had heard of it, and it was like, oh my God, I got to find out about this. This is huge. So the statistics was something that was extremely motivating. So they felt that statistics are something that they can react to, because it demonstrates that it is real, and especially if it's coming from a trustworthy source, like a medical health professional or a medical source, that type of thing. It was also to explain that colon cancer can be prevented was also huge. As I said before, they didn't know. They thought there was no way that colon cancer can be prevented. So once they understood that this is possible, that it can be prevented, many participants were immediately saying, oh my God, I got to tell everybody, I got to get this done. This is important, because in their minds was like, hey, if it happens to me, that's it. And to them, cancer sometimes is a death sentence, and they're thinking of it that way, and they're saying like, there's no way, there's anything I can do about it. But they never thought that it is possible to do something that can actually prevent cancer. And that was a huge piece of information for them. Tell people that colon cancer does not need to have symptoms. So many of them, this, as I said, they don't go to the doctor until something is wrong. And so many said, why should I do anything? I feel okay. I don't have any problems. When I feel something, then I'll react. I'll do something. So once you tell them, wait a second, you may have something, and you may not have symptoms, all of a sudden that fear sets in, like, oh my God, I did not know that that's the case. And that is, again, a motivating factor. By the way, fear throughout in the Latino community is very much a motivating factor. Use strong visual stimuli when communicating with Latinos. This has a lot to do with fear. If you put something, an image that all of a sudden is like a scary image, that they reacted to that. It's like, what is this? What is this? What's going to happen? So to them, the visuals are very important, and Latinos in general react very much to visual. We're kind of visual people. We react to to what we see. That's why television is so effective in the Latino community. So what I have here, language is often a barrier for Hispanics, Latino when it comes to understanding doctors and medical information. So the language itself, it's complicated. So the language could be a barrier, and it's not until you see a visual that it's going to communicate that much better than just the language, because the language itself sometimes is like it's not working because it's too much medical stuff. The visuals help people understand. The pictures can be easier to remember, so they can deliver better because they deliver an emotional response. And again, as I said before, we communicate very much on an emotional level. One of the things that we learned and we heard from many of the participants in this research is they want to hear a firm, a clear message. They don't want to hear something that says, hey, you may die if you don't do this, but their reaction is like, yeah, everybody's going to die. I may die. Yeah. And people said so many times, hey, I hear this all the time. You die, and they tell you one thing one day, and the next day you're dying from something else, and one day butter is bad, and the other day it's not. So they are very cynical when it comes to that. But if it is very firm, if you say, no, you will, die, or you have a very firm message, that's what they want to hear. They want to be able to react. So respondents relate, that it is okay to instill that fear. They said, no, scare me to death, because it's going to push me. That's what it's going to happen. And in the groups themselves, when we did all these focus groups, some people did get scared just because of what we were talking about, to the point that I remember in Atlanta, in one of the groups, there was a females in that group, and they actually asked me to come out. The facility person got me because they were out in the parking lot, and they wanted me to come out to the parking lot to talk to them more about the subject, because they wanted to do something about it immediately, and mainly because they thought it was so important at that point. The information got them to take action. So again, fear and guilt encourages people to step outside of themselves. No one wants to feel it is their fault if something happens to them or their loved ones, so they want to do something about it. The other thing is to make the message personal, to help appeal, to appeal to these Latino emotions I'm talking about. If somebody that is delivering the message has been touched by the disease, if somebody had colorectal cancer, or somebody saying, hey, my father died from colorectal cancer, don't let this happen to you. All of these personal stories, which are emotionally charged, work very, very well. So again, the fear message together with something that is tied to the emotion, it's very, very motivational. Family is a strong motivator. And I said this at the beginning as well. One of the things that we find is that in the Latino community, family is so strong. And we hear this all the time, but, I tell people I do work with all the time, and I when we do research, I tell my clients, hey, whatever you think it is that important, multiply it by 10, because that's how big family is as a motivator in the Hispanic community. Part of the reason it is also a motivator, just to give you a little bit of background to this, a lot of the Latinos here in the U.S. Tend to be new immigrants that came to the U.S. for financial reasons, to make a better life, and to mainly to provide for their children. They are doing everything for the family. So the reason they are here, a lot of them, is because of their family and because of what they want to give their family, what they want to do for their family. So in their mind, they are the provider for the family, and that is their role, and that is the most important thing. To the extent that I cannot tell you how many times I have done research that I have spoken to Latinos and asked them, what, to you personally, what is the most important thing for you personally? And the response is always, for my children to go to college, for my children. They can never get themselves to answer for themselves personally. They're always working for the children. So when you shift this to the family, when as a motivator, when you tell them, hey, you have to take care of yourself because of your family. What happens if you're not there for your family? That changes everything. So they want to be around for the family. They want to provide. The grandparents want to enjoy the grandchildren. The role, even the role of the grandparent in the Latino community is very different because, and I've done a lot of research on end of life and old age with the Latino community. And unlike the general market, when people get older, they tend to move away from the family, go to retirement communities. In the Latino community is completely different. They just move with the family. They move closer. Their role is to be there for the grandchildren, and they want to be around. So when you switch as a motivator, hey, your grandchildren are going to need you. You need to be around, and especially the importance of the grandparent in the Latino society, in which they look up to the grandparent as, you know, the most knowledgeable, that is imparting knowledge and things like that. This is a motivator. They feel like, oh, I do need to take care of myself. I'm not doing it for me. I'm doing it for my grandchildren. I'm doing it for my children, for my family. Use a trusted spokesperson or known celebrity to deliver the message. We asked about this. One of the things that happens, and the names are not important, by the way. You know, we came up with many names and we asked names, but the idea behind this is that, again, Latinos want that trust. And sometimes in terms of the community, they do not have a lot of the role models. So a role model within the community or somebody that they look up to could be, you know, a baseball player, or could be, you know, somebody that is a celebrity of sorts. And if that celebrity, which they trust and they feel connected to, is giving a message, and especially if that celebrity has some kind of a connection to the cause, like if they went through colorectal cancer or they had a family member or something like that, they all said that would be very, very effective. The community may be a powerful avenue. So again, it's not only the family, it's also the community. Latinos tend to feel very strongly about the community and how the community helps each other, how everybody helps each other in the community. So they sometimes take health advice by asking the opinions of families, by asking the opinions of friends, everybody that they know in the community. And by the way, with the Hispanic community, friends very often are part of the family. They, you know, close friends are part of the family. The family is huge. Everything is formed as a community. And in many places in the U.S., community, they tend to live together. I mean, even within a country of origin, they tend to concentrate in different areas, and they have a very strong feeling of community. So anything that is done at the community level is very much motivating. So part of that community, of course, is the church communities, and they spoke about that. So if the church can get involved in delivering a message, that's very powerful. Parents, you know, express that their children are considered members of the family discussions. Don't ignore the children, because many are listening to the children. And as a matter of fact, in many healthcare issues, things are being done through the school system, in which the children are, people are talking to the children at school, especially at the high school level, for the children to talk to their parents and get to the parents that way, because that's very important, and the children react very well that way, and the parents listen to the children. Television to reach Hispanics. So television is a very important media, as I mentioned before. One of the reasons television is so huge in the Hispanic community is because it delivers messages at that different level of communication. It has, other Hispanics there. Sometimes it's very loud, and sometimes it's very different. But you still have Latino families who sit down as a family and watch television together. Now, television advertising could be expensive, but for nonprofits in terms of healthcare, it is very much possible to deliver messages through television. It's just a way to getting that public relations in place. So they want information in reality in many ways. So I mentioned television, and there's Univision and Telemundo and sports, novelas, and medical shows and news and things. They mention all of that. Internet is also huge. Now let me talk a little bit about that. Mainly Facebook and Instagram. So social media. One of the reasons social media is so huge in the Latino community is because, well, two main things. Number one, it enables Latinos to keep in touch with the large family that a lot of times is spread throughout the U.S. and in Latin America, so they can keep connections with their country of origin. And number two, social media is a way of connecting differently. So they go there, they share pictures, they share it's a way of communicating at that emotional level without being in person. It's not in writing, it's not over the phone. You can use all of the visual stimuli, and you can share. So it has become very, very important, and Facebook in particular is very big in terms of a tool to be able to communicate with the Latino community. And then at the community level, like I said before, churches, even supermarkets, hospitals, health fairs, community centers, anything that is at the fairs, festivals, anything that is at the community level. And then there's other outlets, text messaging. Latinos over-index in terms of use of smartphones. They pretty much access the internet through a mobile device. So text messages is very big, and radio because of the music, which is very big, even though the music varies by country of origin, overall is very big in the community. The newspapers, because of the language, there's all these, and I'm not talking about national newspapers, I'm talking about these local papers that they have at the community level. And then there's the out-of-home advertising, the billboards and the signs and things like that. So the last section I have here that I want to cover is we talked, we presented some messages. And this is what I said in the research. We first went out and got some information, and then we created some messages. And we went back with the second phase of the research and tested the messages. And these are the top 5 messages that came out. And I want to present them here because I think there are nuggets of information as to why this rose to the top. Message A says, if you're 50 or older, you're at a higher risk for colon cancer, even if you're healthy. Ask your doctor for a screening test. You can do a simple test at home. So what about this message? Well, it spoke to them immediately because of the age. If you're 50 or older, whoa, that's me. So it gets the attention of the people at this age level. The fact that they are at a higher risk for cancer as they get older made sense to Latinos. I mean, many of them, it was an eye-opener. Like say, hey, but it makes sense. The idea of a simple test at home, this is something that they didn't know, and was mainly the fecal test that we spoke about before, and they said, wow, I didn't know that is something that could actually help. Even if you're healthy was a key motivator. Why? Because, they say, hey, if I'm healthy, I don't need this. I'm only going to react if I feel something. So that little phrase helped, and many said this message would definitely motivate for them to talk, because it had a little bit of a call to action, talk at the next visit. The second message we have here says colon cancer starts with a polyp in the large intestine. Polyps are very common in people aged 50 and older, but they can be detected and removed before they turn into cancer. Don't die of cancer. Talk to your doctor about colon cancer prevention. This message actually was not one of the ones that we developed after phase 1. We created this message in the middle of the research after hearing so many people saying that they didn't understand how it could be preventive. And we said, okay, let's try to put together a message that talks about, why, what can happen. It could be detected, it could be removed, about the polyp. So the intention of this message was to communicate very clearly the idea of prevention. And the idea of prevention, as I said before, was something that was very difficult to communicate because most people think it is detection and not prevention. The message did very well, and what we find out is that they need to be, they want an explanation. They want a clear explanation of, what it is and why I need it. I mean, don't sugarcoat anything. Just tell me, why is it that I need it? And here it says, don't die. Don't die of cancer. Do this. And they reacted very positive to this. The next message, you are so important to your family. Don't let them down. Don't procrastinate any longer. Get screened for colon cancer today. It could save your life. Family, again, a key motivator. Don't procrastinate any longer. Make them, reflect about the ways in which they are procrastinated. So this was a message that got them to shift from me, like, I don't care about me getting sick. Everybody dies. I will die, to my family. Well, I do care about my family, and what if I'm not there for them and they depend on me? And again, one of the things that I also want to point out is that this whole issue of dependency, unlike the general market in the US, many times independence is valued. In the Latino community and Latino families, there is a lot of value placed on dependence and not necessarily independence. You are supposed to depend on one another. And that is something that there is a value attached to it. And all of a sudden to say, hey, they depend on you, it's like, oh my God, of course they do. Message D, colon cancer is the second leading cancer killer in the US. Starting out with the statistics, very, very effective. It doesn't have to be. Colon cancer can be prevented if found at an early stage. Getting screened is absolutely necessary. Call a doctor today. So a couple of things here. The statistics. Every message that we had that started with the statistics was very, very effective. And not only the statistics, but saying that you need to do something about it. So getting screened is absolutely necessary. Call the doctor today. So there's a call to action in terms of the message. Message C, hi, my name is Maria. I lost my father to colon cancer. He was too stubborn to get screened, but the cancer might have been prevented if he did. Don't let your family lose you too. Get screened and prevent colon cancer. I can tell you, I had people in tears on this message, especially men. I had a guy in Los Angeles, I remember this was, because we did groups and we did some smaller interviews, and this was, I believe, an IDI. An in-depth interview with one person, and he was in tears because he started thinking of his daughter, and he had been at the very beginning of the interview talking about how he wasn't going to get tested and the whole Marshall thing, and at the end he was like, I'm a fool, what am I talking about? Of course I need to do this. So the message directly discussed that whole machismo and addressed that in a positive way. And hit them at a very emotional level. And by the way, Latino men are very emotional, so I get them in interviews to get past that machismo thing. I always tell people that I think we invented machismo to deal with the fact that we cry at the drop of a hat, but that's aside. So one of the things that we did is we tested also some brochures, educational contents. There was an educational piece. It was a flyer that we put out. And this was just for the purpose of the research. We put some information there. They are so hungry for information. This flyer was so well received that everybody wanted to take it home. They just said, can I take this home? Can I share it with people? Because it was information that they didn't have. And a lot of them, especially the Spanish speakers, they found that, because we did research with both Hispanic that spoke Spanish and English speaking, or bicultural. And by the way, they want the information in both languages. Everybody, whatever is done, the information has to be in both languages. That's universal. But overall, the Spanish speakers were even more hungry for information because they seem to have less access to information. So anyway, that's pretty much a summary of all the information we got. So if there are any questions at this point, I can open it up and answer some questions for you.
Thank you, Ricardo. Yeah, we do have a few questions in the question box. The first one, I'll just read through them. Says that colorectal cancer is second leading cancer killer among Hispanics and Latinos in the U.S. Is it not the same in other countries with a similar population? Unfortunately, I don't have those data for Latin American countries. I do know that generally speaking, it's increasing in incidence in Latin American countries, but unfortunately I don't have the data to compare with the U.S.
And even if we do not have that data, they don't know this. Even if it is the same, the big aha and the eye opener is the fact that the statistics says it's the second leading, cancer killer. And all of a sudden they were like, wow, and that's what is getting them to react.
Right. So clearly the need is probably very similar to what you experience in the U.S. Hispanic populations. So we do have a few extra minutes. If anyone would like to. Let's see, there's some more questions here we're just noticing. Someone had asked if this will be posted online after this webinar. Yes, it will. If you go to our nuestrasvoces.org, we post all of our webinars online, so you can view the recording afterwards. Let's see. Ricardo, someone would like your contact information, and maybe we can put that on our website, or I'm not sure if you have a slide with that, Ricardo, or not.
Yeah, I do not, but it's very simple. If you go to HispanicResearch.com, that's my website. So if you go to HispanicResearch.com, you can get me through there. And my company is Hispanic Research, Inc.
Great, thank you. This question, Ricardo, what was the nationality of origin of Hispanics, Latinos who were included in the focus groups? Was it a mix of backgrounds?
Yes, it was a mix. We on purpose screened to be representative of the different areas. So we did groups, as I said, we were in the New York area, we were in Atlanta, we were in Los Angeles. We went through different regions, and within each region, we made sure that we had Latinos of different nationalities represented.
And these were a mixture also of first generation, second generation, etc.
Correct. We had both. We had unacculturated. I believe, and I would need to go back and check because my mind is getting a little confused on this. But I think we had 3 levels of acculturation. So we had the unacculturated, which were Spanish speakers, spoke very little or no English, and then we had in the middle the Spanish dominant, but they had been in the U.S. long. They were more acculturated in that respect, and they spoke English but preferred to speak Spanish. And then we had the bicultural that spoke both English and Spanish. What we did not, the participants that we did not include were Hispanics that were fully acculturated, because in our view, those are already part of the general market.
Okay, this next question, are there printed visual resources available besides television that can be used for non-readers? That's a tough one. I'm not sure that I have ever seen anything in print that doesn't actually have text, although, well, I was going to say part of the American Cancer Society brochure that Ricardo showed had, I think it was a birthday cake with 50 and an arrow to the telephone number for the hotline. But Ricardo, are you aware of any others?
No, I think in terms of visuals, I mean, I've seen a lot of information that gets put out visually through social media. You know, especially, you know, social media sites that rely mostly on visual information, like Pinterest, for example. So there's a lot of companies that are using Pinterest just to communicate, and it's all through images. It's not done in any other way. But also at the community level, out of home advertising, billboards in places like New York, where subway signs and bus signs are important. A lot of times you see those ads, and they are mostly relying on visuals. That's how the ad is communicating.
Right, right. I guess you have to know some very basic language skills, but combine that with the visuals, and hopefully that's getting people's attention and making sense. This next question, did the research extend to migrant Hispanics with low literacy? I think you sort of addressed that one. And then it says, what about those who did not have insurance?
Yeah, we included people with insurance and without insurance in the research. We also had we also screened and we checked, during the research, we had people with we had some undocumented immigrants also as part of the research without insurance. So we had all sorts of different Hispanic participants.
Great. A question about where we can order the educational materials in Spanish. I think this may be referring to the one that you put up, Ricardo, from ACS that you said was really popular. If that's the case, I believe they can be located at American Cancer Society's website for download.
Also, the colorectal cancer website will have the whole brochure. If you search on Google for colorectal cancer Latino, you'll get to our presentation there, because it's public, it's posted.
Right, and I also just recalled that it is on our website, the nuestrasvoces.org website. So it's under resources, cancer, print. So it's available there. The next question. Can you please talk more about the use of text to communicate health messages? We offer a texting program and are not currently getting many registrants. I'm assuming that's meaning like a text message, a mobile reminder system, or a mobile communication system.
Yeah, I've seen text messages used to communicate. They gotta be, again, because it's text, it got to be something very simple with a link. So basically the way it works best is if the text messages is actually a link that opens the browser to something that has more communication in terms of video and visuals and things like that.
Okay, and I think we've answered this one to the best degree we can about health literacy issues beyond translation. Are there other formats that resonate best for low literacy? Obviously, those that are more image heavy with a clear sort of call to action to call a phone number for more assistance. And I do want to point out that here at our organization, we have a toll-free bilingual helpline It's called Su Familia, or Your Family, and we always include that call to action on any type of consumer brochure or information or video to call the helpline for additional information. And we can provide that information to callers. We have a doctor and a nurse who answer our lines, and they can also help sort of navigate the healthcare system, providing culturally proficient referrals to clinics or nurse practitioners or physicians in someone's local area using their zip code. Let's see, there's a lot of great questions. Yeah, go ahead.
Yeah, one of the things that for low literacy that works really, really well is video, a link to a video. And the video that you mentioned at the beginning of the presentation, your video that you have on the website, that would be, that's a great way to get to the low literacy people that react more, from the video communication.
That's so true. I mean, I think in our experience here, in all the different sort of methods of communicating that we try, visual, TV ads, PSAs are always the most impactful and generate the most, the largest number of responses. So, unfortunately, that method is really cost prohibitive in most cases. But if you're in a situation where you're able to put together a PSA like that and then contact PSA directors at TV stations or radio stations in cities or municipalities that have large Hispanic populations, I mean, we've done that before and have had a lot of success. This next question. How can providers better engage patients in the conversation for colorectal screening? Maybe this means sort of that initial broaching of the subject.
Yeah, I think providers need to understand the importance of building that connection with the Latino patient, and I think those that do, they are one step ahead already. All they need to do is bring up the subject, and they will listen and they will pay attention and be very firm. But they have to be firm. They cannot say, in order to engage the patient, you cannot say, it would be, you're 50 now or you're 55, it would be a good idea to get a colonoscopy. There's no way that that is going to get anybody to get a colonoscopy. I'm not, you have to say to them, look, you need to get the colonoscopy. Let me schedule you, and be extremely firm, and that's how you engage them, and that's how you're going to get them to get screened. If you leave it as an option, you will take the option of not getting screened.
Okay, where do folks without insurance go to get colorectal screening? I mean, I can just sort of repeat a little bit about, there are providers out there that offer colorectal screenings of different types at low or reduced sliding fee scale cost, and a great way to help a consumer figure that out is to talk with our helpline folks, and they can do that research with our database. I mean, we have over 10,000 providers in our database, and we can sort of do a search, using your zip code to find a provider in a person's area that might offer a lower reduced cost screening.
And also in terms of getting them to, if they don't have, health insurance, what we heard in the research is that a lot of them say, well, colonoscopy costs a lot of money. But when we brought the idea of, hey, why don't you do the fecal test first? And, that doesn't cost a lot of money, and that is something that is doable. All of a sudden that changed things because, and nobody had mentioned that to them. And the fact is that could be one step. Obviously, if the fecal test shows, blood, occult, blood in the stool, then they, but then they have the motivation. Then they'll figure out a way. I can tell you, once they get that fear, they'll figure it out. They'll go through the channels and they'll figure out a way to get that colonoscopy.
Right. This person says Washington State Health Department says that fear does not work as a tactic. What are ways we can show that this is that is not true for Latinos?
I think it's a matter of understanding the community. I mean, I can tell you from this research and a lot of other healthcare research that we do, that fear is indeed one of the motivating factors for the Latino community. But that being said, I understand because I have talked to many health institutions that tell me the same thing. Oh no, we have determined that fear is not the way to go. I don't know what to tell you how to convince them. I can tell you that, you know, from all the research we do, that is absolutely the case, that, you know, fear. Now, the fact is, and maybe this is where we're trying to get at, it's not a matter of just scaring them, okay? It's a matter of scaring them, of instilling fear with information that says, but there's something you can do about it, not just fear itself. It's like, hey, you know, this could happen, you know, you could die, but you don't have to. This is what you need to do, and take control. And that is a different type of communication. It's just not fear for the sake of fear, because that may be something, yes, if it is just fear, if somebody says, hey, you're going to die, they may say, oh, yeah, right, you know, everybody tells me that. If you smoke, you're going to die. That's a big one, you know, and you guys, you know, you deal with that a lot, but we hear that a lot. Oh, and smokers say, oh, yeah, I'm going to die of anything. So that by itself doesn't work. It has to be together with more information, something that makes sense to them.
Yeah, I would really agree with you there. I think it's all about how you frame the fear or the risk and the consequences of not screening, and always include an easy, you know, call to action or an easy first step to getting more information and being able to sort of address this potential risk without you know, difficulty or embarrassment or things like that. Our next question, were there any particular differences captured between urban and rural Latinos in terms of barriers aside from distance to healthcare?
Oh, we did not get that type of information. Most of the research we did were in urban centers. We did not go to rural locations. The reason being is most Latinos live in rural, in urban locations, so we went to cities. You know, there are, of course, Latinos that are more rural and they may react differently, but that's not something that we had that was within the scope of this study.
Okay, thank you. Can you make the flyer available? So those flyers, you know, the ones that I showed are available for download, which you can reproduce off of our website, Nuestras Voces. You can also download and reproduce the American Cancer Society flyer, which is also found on our website. Someone made a comment that make it your own, or MIYO has some great easy to create templates for postcards. Yes, I've seen those. That's a good resource. Are there any comic book style or novella style health education materials available? Ricardo, have you seen anything like that?
Yes, there are. I have seen novella style. I can tell you it doesn't always work, okay? Novella style work with the older, more unacculturated Latino, and if you don't know, you know, those of you that do not know what the novella style is more, the original novella was a printed booklet in which you have a story told with real pictures, with real photographs of people, and it's sort of like a novella in a comic book type style. And there are ads that have been created that way, and they work with a segment of the market. But to be honest, they also turn off another segment of the younger, a little bit more acculturated. They got completely turned off with that style. So I'm hesitant to use that style because I have done research on it and I have tested those messages, and it has not been conclusive.
Very good. So just a couple more questions here, or comments. Some folks have said that local health departments could be a resource to offer screening services with financial assistance. Others said that, you know, many offer no colorectal cancer screening support for uninsured or underinsured. So it's really going to depend on the state where you're located, the state where you live, and it's definitely worth looking in to see what kind of assistance they might provide. And then the final question, where can we get this research? Ricardo, I believe that this research was used as the basis for a manual guide for providers.
Yes, that manual is available online. I don't have the information here, but I can get it for you. As I said, if you search, it's easy to find.
Right. So that is, George, is that on our website?
Yeah, the roundtable.
Right. Yeah, so it's actually on our website. So almost everything that we've mentioned today is on the nuestrasvoces.org website and under resources. So if you have trouble locating anything, you can you know, send me an email address or respond to the, I think, which is included in the webinar invitation that you received. So with that, we've run over time. I really just want to thank Ricardo so much for the presentation. It was very informative. I think as we see from all of the questions, I think there's a lot of interest out there, and just want to thank you for your presentation. And I want to thank all of you for joining us and for sticking with us through you know, 6 minutes overtime. So one more plug that or request is we'll be sending out an evaluation of this webinar that you'll receive within the next hour or so by email. If you could do us a favor and fill that out, it's really short. That really helps us you know, improve on these types of presentations in the future. So again, thank you. I hope everyone has a good rest of the day, and we'll be talking to you soon. Bye-bye.
Bye-bye.